Thank you so much, Shay, and welcome everybody. My name is Nina Lovelace, and I am part of the Well-Connected Communities Leadership Team, and I would like to say thank you for joining us this afternoon, and welcome to the Wave 2 RFA informational meeting. As Shay said, we will be recording this session, so if you have any colleagues that wish to join us today but were unable to, we will be sending this recording out and making it available on the Well-Connected Communities website. Just a reminder that since we're recording and we have a lot of information to cover, I'd like to ask that everyone please keep themselves on mute if you are not speaking, so that we can make the audio recording as clear as possible and avoid any sounds and distractions. So with that said, I would like to turn it over for a nice, warm, and friendly welcome from the Well-Connected Communities Principal Investigator, Dr. Beth Bernsteel. Beth, are you with us?
I am. Good afternoon, everyone. And it is so fun to be with you. I have to do a disclaimer right up front. I'm working from my home office today, and I have a dog who also wants to greet all of you. So occasionally you may hear a woof, and if so, just smile and we'll move on. We appreciate very much all of you being with us. For some of you, this is not your first description or your first hearing of what Well-Connected Communities is all about. For others of you, it's brand new. So if you are brand new and this is your first time to hear about Well-Connected Communities, we're thrilled for that, and we appreciate very much your listening this afternoon. So I have a favor. If it is your first time on, would you please put in the chat box yes? And that gives us a clue of how we're doing in terms of sending forward information about Well-Connected Communities. As we go forward though, let me just back up a minute and talk about from where we've come. And there is a lot of work and accomplishments that have taken place over the last few years that I want to acknowledge. And to set up all of Well-Connected Communities, we almost have to go back in some ways to work that was done by the Cooperative Extension System under the leadership of ECOP, to look at health as a very important initiative across this country. And it was their insight and their need and their passion for bringing health programming forward that started some of this conversation. Dr. Michelle Rogers, who is the Extension Director at Delaware, led a task force and did considerable work around health, which then at a point in time led to further conversations with the National 4-H Council and the Robert Wood Johnson Foundation, which turned into Well-Connected Communities as we know it today. So what you're hearing today is not something that's just happened. It's been years in the making, and many of our colleagues had a very important role in it. Wave 1 of Well-Connected Communities has ended, and for the land-grant universities and the cooperatives, we've had great successes. I think somebody may have their mic open. If you could click to mute, that would be great. Our cooperating land-grant universities in Wave 1 had incredible opportunities. They brought together community councils. There are some wonderful stories to tell and share, and we'll do more of that later. But as we move today forward, we have ended Wave 1 funding, and now we're looking at Wave 2. And Nina and Shay are going to go over that. But the bottom line is, going forward, we want to support a long-term vision and goal of the Robert Wood Johnson Foundation to reduce premature death in this country. It was the need to improve health that ECOP recognized as they talked about equity in healthcare, as they talked about whether it's the mortality rate of children, whether it's access to food. There are so many things that are causing that issue to be so important today. So Robert Wood Johnson, the Cooperative Extension System, and the National 4-H Council have been partnering through Wave 1 and now to Wave 2. One of the things that Nina will point out is that as we go into wave 2, policy change is very important. It isn't just program implementation, but how will we begin to help drive forward some policy change, whether we call it small p or big P, small change at a local level or a big P at a national level. What can we do to improve all of the need for greater health care in this country? So that's wave 2. We're going to be so thrilled to have all of you submit an application for consideration. And we look forward to great outcomes as we move forward in this partnership with the system, with Robert Wood Johnson and with 4-H Foundation or 4-H Council. And Nina, maybe the last thing is we always refer to this as WCC. So if you're new, just know that WCC is Well-Connected Communities. Welcome. We enjoy having you with us, and we look forward to many applications. So Nina, back to you.
Beth, thank you so much. I really appreciate that welcome, and I want to also extend my warmest welcomes to each of you. We have a very big group here. We were not expecting this many people, so much so that we had to send an email asking folks to consolidate and share space if they could so that we could accommodate everybody. So we're just thrilled with the participation today and excited to share with you what is coming up, what you can expect through the Wave 2 RFA. And I actually believe we have Dr. Michelle Rogers here with us today from vacation. Michelle, I don't know if you're here or not, but would you like to say hello?
Hello, everyone, and excited to have you here. And I'm with you in Washington, D.C. at the Air and Space Museum, so on vacation, but just checking in and delighted that many of you are here. And we will hope to continue to support you through this application process as you move forward. And I think Shay and Nina will give you information that you need, and then they are your key contacts to go to as we move forward. But the important thing is thinking about these coalitions and work in your community and how it can overlap work that you're already doing and turn it into this work. So we're excited to tell you about that, and I'll turn it back to you.
Thank you so much, Michelle. And thank everybody else. And just a quick reminder to keep yourself muted during the duration of the call. We invite you to add comments, thoughts, or questions to the chat section. We are going to do our best to work our way through this presentation and take questions where we can. If we are unable to get to your question today, we will be monitoring and responding to all of the questions from the chat box and sharing those questions along with the video recording after this meeting today. It'll be shared on the Well-Connected Communities website. So just to be aware of that. And if you also wouldn't mind, I saw a lot of yeses in the chat box, and I've also seen a lot of familiar names and faces from our Wave 1 LGUs and communities with us as well. So if you wouldn't mind, as I'm getting started, if you entering your name, land grant university, partner, or community in the chat box so that we know who's with us, we would greatly appreciate it. So welcome to the Well-Connected Communities RFA information call. Appreciate you being with us today. And as Beth said, when we started this initiative in Wave 1, we didn't even have a name. And we settled on Well-Connected Communities because this initiative is about health and wellness, and communities are represented in so much of what we're doing through their networks and bringing people and resources together to promote wellness in each of their communities. This is a unique partnership that we have, and because of that, Robert Wood Johnson has invested us in Wave 1 and hoping that there will be an investment in Wave 2. It's a partnership of the Cooperative Extension System across the country and National 4-H Council, supported and funded by the Robert Wood Johnson Foundation. Next slide, please. The vision for this, if Beth and Michelle haven't made it evident so far, is to create a culture of health across the country. Through this partnership, we would see local communities involved in the work and identifying what their local needs are and how they can engage together. We also hope that we can facilitate and bring together local partners to talk about projects and initiatives that they can engage in their communities to help in creating that culture of health locally and across the country. We envision healthy children who will achieve more in school, adults who are productive and thriving in their lives, and community members who are also a part of something that has equitable opportunities for everyone to achieve health and wellness within their communities and whatever that means to them. That's the overall vision for this work through the Well-Connected Communities Initiative. And our goal is to really cultivate health and wellness in partnership with others. And that's so much of what this is about, is the partnership and working together, especially with those we haven't worked with and for in the past. Next slide, Shay, please. So these are the major components of the work that you'll be doing as part of Well-Connected Communities. We have a long history of youth and adult partnerships and extension, whether it's through our 4-H program. And as you know, the 4th H stands for health. And we have a long-standing relationship of recognizing the value of youth and adults working together in an environment where learning and mentoring takes place. There's a strong emphasis on the youth and adult partnership piece in this initiative, and you will see that we say that early and often through this RFA, and we reiterate it a lot through the work that we do together. We're looking to them to partner together as equal partners and leaders, and taking part in creating change in their communities and having a seat at the table. What we've learned through this work is youth have been really integral in bringing the adults from the coalitions and the communities together and on board. And they've really been, as Dr. Rogers says very often, the catalyst most times through this work. So if you plan to work in an existing coalition, you may find that you'll need to make adjustments in integrating the youth if they aren't integrated already, because they really are the central piece of this work. You'll also be asked to identify coalitions that may be active or existing, or you may even have coalitions that are interested in developing. Within each coalition, you should have a cross-sector intergenerational collaborative that'll be working to identify community needs and advance strategies to make the healthier choice and easier choice in their communities. You'll see through this funding opportunity that we mention youth very often. So if I haven't said it 10 times already, this is your reminder that we really, really need for them to have a seat at the table. During Wave 1, we've seen a lot of youth members that have seats on the coalition, and we've even seen them sitting on advisory or steering committees helping to guide the work of the coalition. So thinking about that and thinking through that in integrating youth into your coalition, it doesn't have to necessarily be one specific way. It's really just integrating them and making sure that they're included in the work. We also have a long history and extension of volunteer programs that have provided peer-to-peer mentoring, and that means a great deal in terms of communities making change. As part of this initiative, and Shay will talk about it a little bit more during the sub-grant deliverable section, we've also developed the Well-Connected Communities Master Volunteer Program that will also add to our repertoire of volunteer programs that we're providing. And as Dr. Bernstein said, we're also focused on preparing you through this work to make a difference at the policy, system, and environmental levels. We talk a lot about this work about small p and little p, and those small policy changes can be as small as changing a vending machine policy at a local school, or those big C policy impacts local legislation or regulations in your community at the statewide or national level. So you will also see a focus on those things in Wave 2 of the RFA. Next slide, please, Shay. So I would be remiss if I did not remind you that this is a pre-award RFA. So issuance of awards and funding decisions is contingent on funding from the Robert Wood Johnson Foundation. This is an open and competitive grant opportunity for all land-grant universities in the system within the U.S. and the District of Columbia. We do encourage joint applications between institutions, 1862 and 1890 or 1994 institutions, but they're not required, but they are welcome if you so choose to do that. Our period of performance for Wave 2 will be this December through October 31st, 2021. You will have access to a plethora of benefits, including leadership and scholarship opportunities to publish, mentor, and teach. Very often, our principal and investigators through the initiative are invited to give presentations at different conferences and other learning, so do not be surprised if invitations like those are extended to you. We provide professional development through our professional development coaching team that we have as part of this initiative to support your coalitions. And we also provide what we call an online community dashboard, which is really a website that we use as a clearinghouse for all of our WCC work. It's a place that we use centrally where you'll report against WCC performance measures, share stories and impacts of the initiative, and also access resources. Shay, next slide, please. So we are providing subgrants in the amount of $65,000 to lead this initiative and a minimum of 2 existing communities. And by communities, we mean 2 existing and active coalitions. So your application should show to at least a minimum of 2 active coalitions. You'll see in the RFA, we use communities a lot, 2 active communities or 2 existing communities. And what we mean by communities is coalitions. So make sure that through your application, you are hoping to reach and engage with 2 active coalitions. This next piece is very, very important. You must establish fiscal eligibility for calendar year 2020. And our council's fiscal eligibility process is essentially our credit check of your institution. That shows us that you are ready and able to take up on a grant from National 4-H Council and your university is in good financial health. So this may mean that you have to submit a new application while you have an open and existing award letter of fiscal eligibility. So if you have a 2019 approval, that will not suffice for this award. You will need to establish 2020 fiscal eligibility, and that application is available through web grants. So please, 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 I can't emphasize this enough, please make sure that those applications are submitted by the application due date of October 18th. Indirect and F&A, or facilities and administration costs, are allowed as part of this award, but cannot exceed 10% of the total grant award. And these sub-grants are issued on a cost reimbursable basis. So what that means is you have to spend money to receive your money. So you'll incur expenses up front, and we will review and reimburse you for those expenses once they are submitted and approved. Next slide, please. So with that, I would like to turn it over to my colleague Shay McNeil. Shay is the account manager for our foundations work here at National 4-H Council, and she is really your point person if you have questions about the RFA, whether it pertains to the RFA itself, or you have questions with submitting through the Web Grants portal, which is where this application is due through. I do see I have one question from Mara. Hello, Mara, nice to hear from you. Mara's question is, will the one applied for through another 4-H Council grant, for example, suffice for the fiscal eligibility? Yes. Mara, so if you submitted your 2020 app as part of NMP, you do not need to resubmit it. Just attach your award letter, that would be fine. Good question. No problem. So with that, I will turn it over to Ms. Shay.
Hi, everyone. Again, my name's Shay McNeil. Thanks, Nina, for passing on that baton. So I'm going to touch on the subgrant requirements and deliverables with you today. I'm not going to read them verbatim. They are all of them are listed in the RFA, but there is some additional context and information that I wanted to make sure that you all had. So we'll start with that each grantee must adhere to the tobacco separation protocol. That means that there can be no commingling of well-connected communities funds with other tobacco-related funding. So that also means that any individuals that are working on this initiative can't have tobacco funding in their salaries or provide ongoing programming support to any initiative supported by tobacco funding. So ongoing programmatic support means that they are a regular staff person that's working on well-connected communities. Now, you might have someone at your university who is a healthy living specialist You could bring, and they might have, one of the most used examples is Altria, our Health Rocks program. That is funded with tobacco funding. So you might have a healthy living specialist who has Altria money in their salary. So they can't be a regular ongoing person on this initiative, but they can drop in and provide, maybe a workshop or some periodic temporary support to this initiative. There are examples for, so those are just a couple examples. There's also, if you have questions about the tobacco separation protocol, which we often will refer to as the TSP, we do have an FAQ document that's included with the RFA that you can go and look at for some of the most frequently asked questions. So this TSP must be validated every quarter, and you validate that via a validation letter. And there's also a template for that letter provided in the RFA. So the next requirement is you have to engage a minimum of 2 active coalitions, as Nina described. That means existing coalitions that are active in your community. Data from the county health rankings reveals that rural communities have the highest incident of premature death. Therefore, we're requiring that one of the communities must be rural. All communities identified must be experiencing lower than state averages for life expectancy as measured by the county health rankings. The next one is conduct organizational, community, and individual assessments to develop a process for coalition implementation. Each of your coalitions are going to develop and implement a community health action plan that will detail a health focus as well as actionable efforts to address that focus. So these coalitions, they need to be multi-sector and they need to be representative of the community. And one of the most important components is your coalitions must include youth. Youth are equal partners in every aspect of this initiative. So as Nina mentioned before, this is a really big component. So we will highlight and reiterate that you should be included at every step of the way. Next, we've touched on this before, but you will use a community level dashboard that you will use to report on your performance measures. And it's also, there's a component that is a public facing reporting tool. So this is where you'll track your progress on how your coalition is doing against your health action plan. At the end of Wave 2, you'll establish a cadre of trained youth and adult volunteers using the Well-Connected Communities Master Volunteer Program. So a little more information on that. The training required is 40 hours of training. 40% of that will come from the core online national Well-Connected Communities curriculum. And that curriculum is all the modules. There are about 15 of them that you can choose from, and they're all located on the Well-Connected Communities website. The other 60% of that curriculum is provided by the respective land-grant university. And that you can put together that 60% based off of any health initiatives going on in your state, assess needs on the local or state level, or if there's any university assess needs or initiatives. You must dedicate a minimum of 2 FTEs to well-connected communities. So this 2 FTEs can be spread among multiple individuals, such as your extension resource support team members. So this is, it's a grant from National 4-H Council, but it's not just a 4-H program initiative. This is a cooperative extension program or initiative. And so you can reach out for support from your 4-H, your FCS, your ag, community development, get all of them involved. It's supposed to be a cooperative extension initiative where we use all the resources available to us. You'll also be participating in some professional development, some coaching opportunities, and some site visits. So subgrantees new to Wave 2, you'll need to budget to send a team, and a team is at least 1 teen and 1 community or staff member from each community to one of the National Youth Summits on Healthy Living. And so those occur in February of each year. So you could send a team from your community either to February 2020 or the one that will take place in February 2021. Just a few pieces of criteria for your community selection. As we've mentioned before, one community must be in a rural area. Remaining communities can be rural or urban, but you'll need to verify their designation using the U.S. Census county classification. All of your communities that will be participating in well-connected communities must be experiencing lower than state averages for life expectancy, as measured and validated by the county health rankings and roadmaps. So I think we've maybe gotten some questions. Let's see. Is it appropriate to include LGU staff as part of the two FTEs? Yes. So if you have a county FCS agent who is the local county point of contact, that person's effort can be included as part of that 2 FTE. You can spread it. You can spread it however you like. You can have 10 people whose time is contributing to the 2 FTE. So the question was, how are you defining rural? It's based off of the, it's based off of the U.S. Census county classification. So you'll need to use that to determine whether it's rural or urban.
And that's, if you're following along in the RFA, sorry to interrupt, Shay, that's on page 6 of the RFA under community selection criteria.
Thanks, Nina.
You're welcome.
Okay. It says, can the 2 FTE include FRTEP agents? I'm not sure what FRTEP agent stands for, but if they are an extension university faculty, then I believe so. Correct me if I'm wrong, Nina.
I believe so too. I'm not familiar. Oh, yes. Federally recognized tribal extension program. Yes.
Okay. Next question is, are the 2 FTEs per calendar year or across the time frame of the grant? Oh, that's an excellent question. I think the percentage, it doesn't matter whether it's, you need a 2 full-time, would that be annual?
It would be for the duration of the grant. The grant is almost a 2-year time period, so you need to have 2 FTEs committed for that duration.
Okay.
And I see we have some questions about this community site details section of the application, Mike, and we will get to that question as soon as we get there. Okay.
So it asks, is that the one that Mike just asked?
Yes, it is.
Okay. The next question is, in urban communities, would you suggest using census tract data in place of county to better describe the community? So John, I know that this was a question because your community is actually just a neighborhood of Philadelphia. And so the county data doesn't drill down deep enough. And again, correct me if I'm wrong, Nina, I believe for the application, they will need to use the county health rankings data, correct?
Correct. Okay. Lots of wonderful questions.
Okay. Perfect.
Okay. Okay. Thank you so much. And again, if we are not able to get to everybody's questions in the chat box or by the end of the call, we will be looking at and responding to each of these and sending out those answers as well.
Okay. So next up, budgets. So with your application, you will need to submit a budget detail and narrative for the following categories: personnel, fringe benefits, travel, equipment, supplies, contract specialists, other costs, and F&A ICR. So in this budget detail and narrative, you must include cost calculations and list costs within each budget category with a corresponding narrative. So aggregate lump sum requests will not be accepted. So for example, once you get in your budget and you start doing your listing your costs and writing your narrative, in your supplies category, if you just write community A, supplies, and then give a lump sum number, that won't be accepted. You need to provide as much information as possible, include formulas if you can. So if you're doing a calculation for agent travel in and amongst the communities, you would need to write, the 55 cents per mile reimbursement. You're anticipating 200 miles, calculate it out that way. Show us how, in as much detail, how you plan to spend the money that you've been granted. And included in the RFA is a budget detailed and narrative preparation guidelines document. So that's in the appendices as well. So the more detail, the better, is what I can say for your budget detail and narrative. So we had a question about volunteer training. Can you please clarify the meaning of cadre of youth and adult volunteers, especially for some communities that are rural with not a large population? So there's some flexibility on this, but you need to have, at least, I don't want to put specific numbers on it, but you need to have some youth and adult volunteers that are trained master volunteers that have been trained and are giving back to their community, doing, master health volunteer components themselves. So they will give back certain amount of hours once they've been trained. So, there's the understanding that, an urban community obviously will have more people available to pull from than a rural community. I don't want you to get bogged down on specific target numbers that you need to reach, but you should be trying to engage youth and adult volunteers as well as your coalitions in these communities. So next question is, we would like to set aside dollars for coalitions to implement action plans that they have not developed yet. Can those be somewhat lump? So you need to have an idea of you'll need to tell us what you're anticipating to spend. So lump sums, you can't just say we're going to give community A $5,000 to implement their action plan. That would be considered a lump sum. But what you can do is you can do what we call budget modifications. And you can do as many budget modifications as you need to do. So, have an idea of what you want to do in the community, create your budget in that way, listing all of those costs. There are some costs that that you're going to incur. You might know that you'll need facility space. You're probably going to need paper. Think of those costs that that you're going to need and craft your budget in that way. And then as you really dig into your action plan and learn more of what you need, you can always submit a budget modification.
Travel's another big one that we see in the budgets, right, Shay? Travel for your staff to travel between your communities. So that's another big one.
Yes. And just, some examples of what some of our grantees in Wave 1 did is they did exactly what you were describing, Mike. So they had travel for their agents to travel amongst the community. They sub-granted out mini grants to each community, but then they listed, it had to all tie back, everything in your budget, especially the community, if you're going to give sums to your communities, it has to all tie back to how is that money going to help develop your coalition in support of doing this work. So the next question is, I know that there's a maximum for ICR with 4-H grants. Is there a minimum for fringe benefits?
They should be, sorry to interrupt, Shay, you should be using your university's fringe benefit rate. There is no minimum or maximum for the fringe, but you should calculate it based on the personnel that you're including in your grant budget. If that answers your question.
So the web grants portal, is there a maximum word count for each of the questions components for the application? Font size or type, hyperlink, visuals allowed in the portal. So I believe we have opened it up, each section to allow for maximum description and narrative. Is there fonts? I think they're asking if there's a particular font size or type that we'd like for them to use.
No, and that's a great question, Heidi. There's an option in web grants to select your font and to select your font size. So we don't have a particular preference. We just ask that when you're responding to these narrative questions that, you're succinct and you have complete and thorough responses. Although there is not a maximum word count or limit for these, we would like for you to try to be as succinct as possible in responding to those. And hyperlinks, I believe hyperlinks are allowed as part of that. I would not, to be honest, I would not include hyperlinks in any of your narrative responses. If you have any backup documentation to support this application or to support the community work that you're doing, there is an attachment section. So I would encourage you to attach it there, but try to include as much information as possible in those narrative boxes. Our reviewers are not going to want to look through a lot of attachments to your application, so plan on attaching, if any, those that are most important, but maybe not everything.
Yeah. And I was also thinking about the budget narrative section, we did try to open it up to allow you, because as I mentioned before, we want as much information as possible on the costs and how you're going to use your money. So you should be able to provide plenty of narrative on your budget. So the next question is, in Western states, counties are huge, and county-level rural-urban designations are misleading. So for example, of the 15 counties in Arizona, only 2 are mostly rural. Can we look at census designations below the county level? So I believe one of the limitations of the county health rankings and roadmaps is it is only by county. Or, well, this is the U.S. Census Bureau. Does U.S. Census drill down below county?
I'm not sure, but if you would like to provide, in addition to what we're asking for, if you would like to look at census designations below the county level, you can do that as supporting documentation for your application. You can either include that information in your narratives or include it as an attachment. Michelle.
Okay.
Thank you. Great questions.
So I don't see any deliverables, requirements, or budget questions in the chat box at this time. So I will, I believe, pass it back to you, Nina.
Thank you. So over this time, I'm going to be working directly from the RFA, and the application component section begins on page 9. So if you are following along, that is where I'm working from. I am not going to go through each and everything because some of them are self-explanatory, but I will make sure that I hit on the key pieces of the application components. So as I said at the beginning of the call, these applications are required to be submitted through our Web Grants application portal. So if you do not have an account, you will want to set up one as soon as possible. Once you submit your application, you are required to have approval from your state program leader, 1890 or 1994 administrator in order for the application to move on to the review period. If your application is incomplete and missing any information that is required or is not submitted by the application deadline, your application will be removed from consideration from this opportunity. So it's really imperative that you do submit everything by the October 18th deadline. As part of the appendices, we have also attached an application checklist for you to ensure that You've completed all the sections and corresponding attachments, such as the Web Grants 2020 fiscal eligibility application. So I do encourage you to print that out and use that to ensure that your application is complete. So the first thing that you will need to complete as part of this application is the payment recipient section of the application. That is going to ask for pre and post award contact information for your sponsored program staff. And if you don't work with sponsored programs and you're a university that handles everything in-house, you'll still need to provide that information to us. So make sure that that answer is clear and complete. If you don't have a pre or post award contact, it's okay to say we don't have one at this time. Several of these sections are weighted and there are points assigned to them. The first section that is weighted with points assigned is the executive summary, which is worth 10 points of your overall application. In this section, you'll want to make the case for why your LGU should be accepted, detail any current policy, systems, and environmental work that your university is doing, and talk a little bit about how this initiative will fit into your overall state plan, among some other pointed questions that we ask you as part of the executive summary. So just make sure as you're looking through these, if there's a question there, just make sure that you answer it. The community selection plan. This is the form where you will share with us what communities that you plan to work with. You are required to respond to each of the questions as part of this community selection plan for each community. So you'll want to remember to add a community into the form for each one. So if you're applying for to reach 2 communities, you'll want to make sure you answer each of these questions detailed on number 5, page 9 and 10 under community selection plan. We are asking for location information, where the county that the community is located in, that rural urban designation. We are asking you to list that as well, letting us know if it's an existing, new, or returning community, and by returning we mean if you're a Wave 1 pilot state, consider our pilot states and Wave 1 folks all 13. So if you're one of those 13 pilot states, wherever you see Wave 1 pilot states in the application, we're talking to you. We're also asking for an abstract where you'll share a little bit about how you chose the communities and why you selected them. How you will involve community members and youth in this coalition work, as well as extension staff, share any existing data you have on the community. So for those of you that have concerns about the county classification lookup table, if you've got some information using the census tracts where you want to drill down, you can share that as well. Or if you have reports, you can share that in the attachment section as well. You'll need to share with us your anticipated or projected number of volunteers. We're asking for adult, youth, and master volunteers in this section. And we also want to know a little bit about what sectors you plan to work with as part of the coalition work for each community. And there is a plethora of options and a drop-down list. If it does not fit, you may select other and let us know what that is. And you'll also be required to let us know what the county life expectancy or premature death rating is using the county health rankings website. So you will see that when you do that, your county might be, for instance, ranked 6 out of 30. So that means you are number 6 out of 30 in your state. So you'll want to just let us know that you're number 6 there. And we will be verifying all of that through the application review process. Next slide, please. The narrative questions are weighted the heaviest as part of this application. They are 60 points. Depending on if you are a Wave 1 pilot state or a completely new applicant and potential subgrantee, the points assigned to each of these questions may differ a little bit, so please make sure to pay close attention to where you are required to respond. The narrative questions, they start on page 10, number 6, under application components, and there are several questions there. We want to know about your staffing plan. We're asking you to detail the expertise and experience of the staff members you plan to engage in this work, assign roles and responsibilities to each, and share a little bit with us about how you will allocate those FTEs. If it's a joint application, if you plan to apply with another university, describe how multi-institute staffing will be managed, because that can be a little bit tricky, and we would like you to share that with us. We'd also like to know a little bit about your current youth and adult volunteer management program. So share a little bit about the status of your current program and how the work of the Well-Connected Community Initiative will be incorporated into the existing program. We would like for you to detail the capacity and competencies of the staff that you detailed in question 6A in the RFA, and let us know how they are able to meet those capacities and competencies. We have attached the WCC capacities and competencies as an appendix to this RFA. Please use it. We've put it there for a reason, and we want you to make sure you use that as a guide. The goal of this is to demonstrate the competency for each staff member in your staffing plan in the areas of collaborative leadership, place-based change, as well as data-informed decisions and progress tracking. That capacity and competencies document walks you through what is needed to be effective in those key areas. So please make sure you're using that when you respond to that question. You'll also want to describe a successful community development project, include youth and adult engagement, community health coalitions formed, and the role of cooperative extension system and impact realized. So we want to know if you've done this before. We want to know how you were successful in doing it, who did you work with in extension to accomplish it, and how did it go? We also are asking in the narrative section that you explain cross-unit collaboration. You'll want to provide examples of collaborations within extension and other units in your LGU that have focused on community problem solving. System change, as Dr. Rogers says, is a big component of this work. Through this work, we are going to work differently than we ever have. You may have to work with your community development colleagues, your FCS colleagues. So we're curious about if you've had to do that before and how it went and how you engaged them and what everybody's roles were in that process. Next slide, please. And lastly, the timeline. So there's a community change cycle in Appendix D that details and shows you the steps to coalition building and development, some of the things you'll be wanting to do and think about and accomplish as part of this work. So use that when responding to this question. We want a detailed timeline for how you will implement this work through the initiative and the different deliverables using that community change cycle. So please make sure that you are using that when responding to the timeline section. In the timeline form and web grants, there is the option to use or to enter a chart. We've seen a lot of grantees be successful in doing that. Please do not attach a timeline to the application. We want you to make sure that you complete that within the form and web grants. And there is the option, like I said, to insert a chart. If you have questions about doing that, give us a call and we can certainly walk you through it. So I will pause there. The other web grants component that is not listed here that I forgot to include is that web grants application. So when you log into web grants, if you are not familiar, if you click on funding opportunities, you will see the 2020 fiscal eligibility application listed there as an open funding opportunity. It opened several weeks ago, so it is available for input now. Those are not applications that we monitor and approve here on our grant management team at National 4-H Council. Those are reviewed and approved by our finance team. So if you have any questions related to the status of your application or questions about the application, there is a general email inbox that our finance team looks at and responds to. We've also included as an attachment an overview of the fiscal eligibility process. So if you're not familiar with that, take a look at that. Generally, someone from your sponsored programs office completes that information, or your finance office completes that information. So just make sure that you are working in concert with them to complete the application. One thing that I will share that we see oftentimes is the person completing the application for funding isn't the same person completing the fiscal eligibility application. So make sure that that university name that is in the payment recipient section of this application that I talked about earlier, please make sure that that LGU name matches the name that was used as part of the fiscal eligibility application. That LGU name that will be approved as part of that application is the name that we will contract with and issue payments to. So they do have to match. So just make sure you're in communication with that person that's submitting it if it's not you. Okay. So I will pause there. I've seen several questions come in, so I will do my best to answer them. If I can't answer them, we'll get back to you.
So Nina, one thing that there seemed to be a number of questions related questions. A lot of people were asking about how, so in their state, they have large counties and there might be, so for example, Alaska was one of the examples. Most of Alaska is rural, but the area where Fairbanks is located, you know, because Fairbanks would be considered urban. And so there were some other questions related, you know, in Georgia, for example. So it looks like we might need to provide a little more guidance on, you know, this urban rural designation because several people had questions about it.
And it's a great question. And Mara, I know that we've encountered this together as part of the National Mentoring Program. And if through this application, and Mara, I'm using you as an example, where your community or county is indeed rural, but it might share or report that it's considered an urban designation. If you completely disagree that it's not an urban location and it's indeed a rural location, provide some backup documentation in that attachment section that supports a rural classification. We want you to use the county classification lookup table. That is going to be where we look at and verify it. But if you believe strongly that it should be classified as rural, provide that backup documentation in the attachment section, and we will certainly consider it. And if we have more questions, we'll reach out to you. I know that's as clear as mud, but that's probably the best we can do at this point if there's strong disagreement. I hope that answered your question.
So there were a number of questions that came through that I tried to answer in the chat box as you were talking. So I think the next question is a budget-related question. Personal and fringe benefits are included in the proposal if, for example, we hire only one coordinator for 2 years. If we pay $20 an hour for 10 hours per week, the total without fringe benefit is approximately $20,500. Based on the total amount of the project, what are your suggestions in supporting this hiring? So Virginie, that how you staff and structure your staffing support for this initiative is that is a budget decision that you'll have to make. You will have to prioritize, is this hire, you know, at 0.25 FTE at $20,500, is that a top priority? Because that's almost a third of your budget for this one hire. So this is supposed to be community coalition engagement and development work. You might want to maybe figure out other ways that you can support this hire. I don't know if there's other grants or university funds, but that would, you'll have to determine what your priorities are for your budget and plan and budget accordingly.
Shay, I see a question from Gail Kennedy. I'm not sure if you answered it there, but it says in the community selection section under E, there's a drop down asking for new or existing coalition. I thought the coalition had to be existing. So that's a really good question. Two of the coalitions that you're going to include in your application must be active and existing. If you have coalitions that are in the development stage or that are newer that you would like to engage with, you may do that, but a minimum of 2 have to be active. And that's Gail Kennedy from New Hampshire. Hello, Gail.
Let's see. For Wave 2 LGUs, did you say a minimum of 2 active coalitions would be placed under existing in the community section? Yep, so Heidi also had a related question. So you have to have 2 communities at a minimum that have an active coalition, but as Nina said, if you want and have the capacity to add a 3rd community, that could be a new one. The state of Alaska may handle health reporting differently because they need more granularity than our massive census districts. So that's a comment related from Mara related to our determining urban versus rural.
Shay, I also see one for John that might be worth repeating for everybody else in case they're not monitoring the chat box from John Burns or Burns, if I'm mispronouncing that, I apologize. But the Wave 1 pilots include self-funded as well as funded. The answer to that is yes. So if you were one of those 13 LGUs we engaged with in Wave 1, you are considered a Wave 1 pilot when responding during the RFA.
So there was a question that says, is hosting allowed? I'm not, can you provide maybe some more context on what you mean by that? Jill Baker-Tingy.
And if, while Jill's responding, Catherine Morgan, if you are new, should you have a login to see the RFA? Yes, you do. So if you do not have an account with WebGrants, you should sign up to receive one so that you can access and apply for the RFA. We will also be posting the RFA as well as a recording of this meeting on the wellconnectedcommunities.extension.org website, and we'll make sure that we pop that in the chat box as well. And I also see from Mike Young, you do not see an attachment section. Well, Mike, there should be an attachment section. I'm not sure why there is not, so I will check on that, but there will be.
Yeah, and when you're in WebGrants, if there's something that you're seeing that you, if there's something that you're not seeing that you think should be there, or if you're seeing something that's there that you have questions about, you can always email me. I also recommend if you can grab a screenshot of what you're seeing, that'll help me better be able to know what you're looking at so I can hopefully help you out. The next question is, can the 2 FTEs be divided across current extension employees so that we would designate a percentage of their time to this grant? Yes. For LGUs in Wave 1, the 2 communities should be new communities in addition to the 3 we already worked with. So Ollie, this is as a Wave 1 LGU, this has kind of been a moving target for how we're going to engage communities in Wave 2. So the RFA, the requirements for Wave 2 are a minimum of 2 communities. So if 2 of your communities from Wave 1 return for Wave 2, then you have met that requirement. And then if you, so you've met that requirement. If you want to, if all 3 of your communities want to return, or if you have a 3rd community that you would like to add that you haven't worked with before in Maryland, then you can add that.
We are at the top of the hour, so I want to make sure that we cover the timeline and some key dates with everybody before we sign off.
So, okay. So I see that we have about 14, about a dozen or more questions left to be answered. So I just wanted to reiterate what Nina said at the beginning of the webinar is we will go through all of these questions and we'll create an FAQ document that we will send out with a recording of this webinar. And also, if you think of anything, after we log off and that question comes up and you're like, oh no, I didn't ask it, feel free to send me an email and we can include it in our FAQ.
Okay. So really quickly, since we are at the top of the hour and I want to be respectful of everyone's time, just a reminder that applications are due no later than October 18th by 11:59 p.m. Eastern time. So if you are not on the East Coast, you can do that math for yourself. Don't trust me to do it. Pending an award decision by Robert Wood Johnson Foundation, we hope to distribute and make funding decisions in December of 2019. So if you are selected as a grantee for Wave 2, you'll be notified of that status sometime in December, which I know is a tough month for everybody with the holidays. And we hope to distribute sub-grant agreements between January and February of 2020 and turning those around to you as soon as possible. There is a timeline within the application with other key and important dates in it on page 7. So take a look at that. I think it's important for you to review that to review some of the key sub-grant deliverables that include the reporting dates for this work. So be aware of that and make sure that you review that as well. Next slide, please. And as Shay said, she is your contact for all of your web grants and RFA related questions. So if we did not get to your question today, we will get to it as part of the FAQs that we will be circulating after this webinar. So if you did not get a question in via the chat box, please don't hesitate to shoot Shay an email with that question and we will make sure that we include it for the benefit of the group. Shay will be available for the duration of the open RFA period, so her support to you does not end today or even next week. You've got her until, I believe, October 17th. There is a question cutoff deadline in the RFA. I believe it's October 17th, so we'll make sure that we include that date and time that is the cutoff for questions out to you. Typically, it's 24 hours before the RFA is due. So we thank you very much, appreciate your attention and really wonderful questions today. And we look forward to reading each and every one of your applications. Have a great day, everybody, and don't hesitate to reach out if you are in need of something. Thank you.
Thank you.